Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release, ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. All right, Melissa, tell me what's going on with your headache.
So I started having a headache on Saturday. Today's Monday, and I had a headache. Like I took Advil on Saturday in the morning, and it kind of got a little better, but not all the way better. Then I took 2 Aleve, and it still got a little better, but didn't go away. And then I went to bed, and Sunday I woke up, and I still had the headache.
So you've been having constant headache for the last 3 days?
Yeah, and it just doesn't go away. And then finally, I took Excedrin migraine yesterday, didn't work, and then finally I went to the urgent care because I'm wondering why is this not going away. And they gave me a shot, and that helped. But then this morning I woke up and it's still just not as bad. I'm a little better, but just sore, like in the back of my head, my neck.
How much headaches from 0 to 10? 10 is emergency room.
Like right over the weekend was like 5. Right now it's like 3 or 4, just sore here.
Okay.
Not as bad, but it's still not.
So you feel it coming from the back all the way to the front?
Kind of, yeah.
And do you feel it in your chaps, your muscles on the
sore
side?
here, and my neck and my shoulder, like up here.
Okay. So everything we do should be pain-free, okay? All right. So I'm gonna work on it. Wow, you're very tight. It's more tightness here, actually. You feel this knot here? You feel this, like, kind of rock-hard feeling?
Yeah.
That's the scar tissue, yeah.
Yeah.
So we're gonna work on that. Okay. So did it start like in the morning, or what happened? Did you have anything like happen different that's
the only thing different, I think I'm trying to get, I have a mattress, but I've had a mattress topper that I'm trying to replace. And so
that's a headache by itself.
Yeah, and I think, you know, I'm trying to find the right one that hopefully will, I don't know.
Yeah, it's hard.
Yeah.
It's hard to find a good mattress or pillow top
Yeah.
or something like that. That's not easy.
So I've been trying to do that the last few weeks, so maybe that's it. I know, it's...
So you tried different mattresses, pillow tops or something like that. Yeah, well, part of it, like if you feel it in the morning and you did not feel it the night before, it's either you have a bad mattress, bad pillow, the way you slept, or there's some kind of inflammation.
Yeah.
But if that's the change that occurred lately, it sounds like that's like the pillow top or the mattress.
Yeah.
You know.
Because I'd wake up and my back would feel kind of sore. I'm like, what?
Oh, so when that happened, that you know that's not the good pillow top.
Yeah.
That is not that one. Yeah. Don't say like, oh, it's gonna take a couple of days and I'm gonna get used to it. No.
Yeah.
That's the wrong one.
Yeah.
That's not a good one.
Yeah. Feels a little better already.
So Melissa, can you give me like a little brief history? Like when I see you several years ago, what was your condition? How many treatments? And it was a while ago.
No, it was when you were in Mission Viejo. I don't remember how long ago that was.
It was like at least 3-4 years ago. Yeah.
It was when your babies were born. How old are they now?
The twins. They are actually close to 4 now.
Yeah. It was in the fall. Yes.
And
your babies were just born.
Yeah. So
that's when it was. So I had headaches every afternoon, like
daily headaches.
Yes, and I was always taking medicine. They'd get better, but every afternoon I'd be getting a headache. I'm like, what's? And so
that was 4 years ago.
Yeah. And it was just so annoying, and I finally saw, one of my friends was telling me and I don't think she saw you, but she said, oh yeah, I've done like soft tissue release. I'm like, what? Like, what is that? So I was looking up, you know, people in my area, and you were there, and so I'm like, and when I started going, like even after the first treatment, I didn't get a headache for a couple days, and then after, I think I only went
a couple of treatments or something like that.
Maybe a month to, and after that, I didn't have headaches
for
till like now.
Okay, so it's almost like 4 years. That's good.
Yeah.
Good.
But I improved my posture, and I improved my sleeping posture.
Yeah, because you have to do the whole program, you know.
Yeah.
So yeah, in the video I usually do the manual stuff, but behind the scene we do exercises, we work on the posture, we work on nutrition, if there's inflammation we work on that, stress management. This is called the biopsychosocial model that actually proven a lot of studies it's provide a long-term result.
Yeah.
We cannot do just the soft tissue and you know and leave the bad posture or body mechanic.
Yeah, and I actually I think probably the last time I saw you was when I got that memory foam, and I didn't realize you're supposed to replace it every 2 years or so.
That's when you had headache the other time 4 years ago.
Yeah, I needed a new mattress and everything. And
probably every time you get a new mattress, schedule. Schedule the treatment.
And I sleep with the pillow between my knees, you know, and I've been really good about doing my best with that.
Do you feel the scar tissue here?
Yeah.
Do you clench your teeth?
Sometimes. I have a mouth guard.
You wear that at night?
I try, but sometimes in the middle of the night I find myself taking it out.
Last time did I give you stuff for TMJ?
I don't remember.
I'm gonna give you some stuff today, for that too. So from clenching,
Yeah, but I do have a mouth guard, and but the problem is I take it out and then I'll put it back in, and then I
at night.
Yes.
So that's woke you up. Wow.
I don't know why.
Does it fit you well, or you have
the
problem with that?
dentist made it.
But why are you taking it off?
I don't know, sometimes after a while it just bugs me and I take it out. I've been doing this for 2 years.
That's what you up in the middle of the night.
Yeah, I don't know why.
So how often you do that? Like middle of the night, you leave it and...
Yeah, sometimes I'll make it through the whole night without.
So if you're not wearing it, do you clench?
If I'm stressed, I clench, but if I'm not so stressed, I don't.
Okay, I'm gonna give you some exercises for that. Yeah.
When Carrie, you started seeing Carrie, and I was kind of worried about her. I was clenching then.
So you start to clench.
Yeah, when I'm stressed, I do. But if I'm not, then I don't. I still try to sleep with it every night, though.
So I will give you some breathing exercises and stuff for stress. So make sure you manage it without clenching in your teeth. But you definitely, when you clench, you need to wear the night guard so you don't crack your teeth. It's more expensive to fix the teeth than wearing the night guard, you know.
I've cracked 2.
Oh, you did? My wife cracked 1.
Yes.
Yeah.
And that really was so painful.
Very bad. Oh my goodness.
Yeah.
Sorry about that. That's not fun.
No.
Okay. How about now? Do you feel any difference?
My shoulders, yes.
Let's move your neck left and right. We should have done that before.
So much better.
Do you still feel headache or it's gone? And extend and back and forward.
Still a little bit sore, but I feel like I can move now.
You move further, but you feel a little bit tightness? Okay,
still a little bit, but
you're gonna feel cold.
Better, yeah.
Let's put your hair on the side. You're gonna feel cold. You're gonna...
Yeah, I don't know. Yeah. That helped a lot. Thank goodness. So people can have headaches that last
if they do not get treatment
for that long?
I saw a patient had headaches for years. I personally used to have migraines for years, and I was just popping medication like candy until I get to the point this is not working.
Yeah.
And that's what made me start to work on headache and have protocol for headache because I tried it all. And it has to be holistic biopsychosocial model.
Yeah.
You know, you have to work on the scar. We have to work on the scar tissue, the fascia restriction, the ergonomic, nutrition, inflammation, because headache is very complex condition that it's not like, there's no magic element.
Yeah.
You have to address all the deficits that occur that cause headache, you know. So that's when I realized I did not have migraine for the last like 5 or 6 years.
Yeah.
You know,
great.
because I was working on my nutrition, I released the scar tissue, released the fascia, worked on my posture, had inflammation, I worked on that. Stress, I did some meditation and breathing exercises because it's a very complex condition.
Yeah.
And it depends on the patient compliance. So if the patient is not compliant, it doesn't matter how much work we're going to do with them.
Sure.
You know, because they continue eating the food that causes the trigger, or doing the bad posture that causes the trigger.
Yeah.
So
yeah, that was hard for me to change. It was
the
hard
posture,
for Gary to change. Yes.
Yeah, because remember when I worked with you, it's actually it was not the symptoms that we were working on.
Yeah.
I saw you for a month, but not because you had symptoms, but because we had to work on your posture. You know.
Yeah, that was.
You remember? I remember.
It was hard.
You're actually doing very well now.
But yeah, it took.
Your
took
posture
a while.
was like her.
Yeah.
You know what I mean?
It
The same
was.
posture slouching
Yes.
forward like that. Yeah. Yeah. It takes 3 weeks to change a habit.
Yeah.
You know?
It took
So-
like that, and I remember.
That's what usually take time, just correcting habits, strengthening muscle, working on the stretch, behavior modification. But the release usually does not take a few sessions for that, you know.
Yeah.
Okay, so let's move your neck and tell me how that feels.
Yeah, much better.
Mm-hmm. Any headache tightness?
Not too much. Can I stand up?
Yeah, you can.
Because earlier, like, I'd stand up and I'd feel worse.
Oh, okay.
Let me see. This is so much better. I would say, like, there's still a tiny bit of soreness here and here.
How
But
much from 0 to
better.
10?
One.
Okay, you feel it in there and
A little bit
in the
here
back.
and the back.
Okay, let's have a seat. You can facing the camera here. Turn around. Okay. You can move the chair. Okay. Behind your eyes, yeah?
A little bit and still back right here.
Okay. Let's let's work on this. Okay. Sorry, I'm messing through here.
That's okay.
Yeah. Did you have any trauma here?
When I was 19, I was in a car accident.
Mm-hmm.
I had like whiplash.
So I feel scar tissue in your head here, in this area. Feel that?
Yes.
In here. Where did you hit your head?
It was more like a whiplash.
Okay, just the front.
Yeah, I had my seatbelt on,
Mm-hmm.
and
That's here.
yeah, I can feel that.
Do you feel all those bumps here?
Yeah.
Yeah. Sorry.
That's okay.
Is that too
Like,
much, or?
No, it was good.
Because even you had the hit in the front, you hit your head in the back.
Yeah,
in the seat, you know. So usually patient gets scar tissue either front and back. That's if the accident front hit. If it's a side hit, it's gonna be the side.
Yeah.
You know. And you hear that? This is from clenching actually the scar tissue here in the temporalis and the side.
Probably,
Yeah,
yeah.
that's from clenching from more in here.
I know when you started seeing Carrie in January,
Mm-hmm.
my husband, he knew I was kind of stressed out.
Mm-hmm.
And he's like, you should just go at the same time. And I'm
You
like,
should say something.
and I'm like, no, it's okay.
I remember this time you looked stressed, but I did not say anything.
Yeah, I'm like, no, I'll be okay. And then she got better, and I was okay. But I think it still builds up over time.
Let me know if it's too much, okay? Keep your eyes closed, okay? Not too much?
A little bit there.
Sorry, okay. Too much?
It's okay right now.
Okay. Sorry. Do you have any allergies or anything like that?
Not too much, just seasonal, but mostly in the fall.
Sorry. Want to make sure you drink enough water.
Yeah, I brought my bottle in the car.
Okay, let me get you some water here. Okay. Alright, so how does it feel now?
Much better.
In the back and the front, do you feel anything?
I'll be stand up.
Sure, yeah.
Much better.
Any headaches? We need to give you some water.
Just a little tiny bit sore back here, but not that bad.
Where?
Where all the bumpy was right here.
Yeah, you just feel like the pressure or just headache? I need to
Just
get
was a little sore.
a little sore over there. From 0 to 10, how much?
Still like a 1 or a little less than 1.
Okay.
Not too bad. My eyes
Just
feel better though.
your eyes feels better?
Yeah.
Okay, so let me get to this. Okay, it's right in here, you feel it?
Yeah.
Okay. And here?
Mhm.
Well, if I give you water now, it will feel. Let me do this.
Mhm.
Do you drink enough water?
I try to. I like that hint water.
What hint water? What is
It's
that?
just there's no flavors. There's no like artificial anything. It's just water. You can get it at Whole Foods.
They put something on
They
it?
have like a flavor. Yeah, there's like it's flavored water. Like they have strawberry or
You can do your own thing.
I know, and I do sometimes.
You can do it very easy.
I
if
do
you
in the
want
refrigerator.
hint,
Yeah,
you know, just
I
have
do.
your water, a few drops of lemon,
yeah,
or you know, just put a piece of fruit.
yeah. I do
You
that.
know, and eat the fruit at the end. That's more natural than anything
Yeah.
because you really don't
For
know
sure.
how much like and what they do, and you have to have it refrigerated because it
Yeah.
will go bad.
Yeah.
You know.
Yeah.
So yeah, your fascia's really tight here. You feel that?
No.
Yeah, your fascia's really tight here. Sorry.
Can you just a little? Here, sorry.
Mhm.
Is it right here a little bit too?
Okay.
Yeah.
Feel that? I'm gonna work more on it next time. Okay. But you feel all this tightness here. It's your fascia.
So I must have had a tension headache then.
Yeah,
What do
it's
you
a
think?
tension headache. Well, if it's
Is this tight?
yeah, well, tension headache. That's very typical with what you have because all this tightness, and when you feel better after this treatment, this is like classic tension headache.
Yeah.
Because with ASTR, it's easy to work on the tension headache.
Mhm.
You know, migraine it takes a few sessions
Yeah.
too, but we have to do a lot of different things. You know, nutrition
Mhm.
and
Yeah,
stuff, other stuff. But tension headache is usually scar tissue, fascia restrictions around this area. So tell me how this feel.
Yeah, much better. Like it removed my head.
Yeah. Any headaches or it's gone?
No.
So how you feel now?
Much better.
All right. So what do you think about the ASTR treatment?
It's amazing.
Yeah.
Yes.
Awesome.
Thank goodness I've been able to come.
Yeah.
I was kind of worried last night. I was like, what's wrong?
Because you
with
had
me?
3 days
I
and
know, and I was.
you tried everything and even the urgent care. I can't believe they give you a shot. It's the first time.
No, because
Yeah.
because I was thinking, what's wrong? This is.
You tried everything. Yeah.
I've tried every medicine.
Yeah.
It's not going away.
But here's the problem with the tension headache. Tension headache medication will not gonna work because it's usually scar tissue and fascia restrictions.
Yeah.
So if you don't have mechanical force to release it,
It's just gonna
medication will you're not gonna feel the tightness until the medication wears
wears
out.
Yeah.
You know, but you have to have mechanical force to release it.
Yeah.
You know.
No,
Yeah.
no, this is better. Thank you.
Yeah, you're welcome. Thank you so much. Yeah, thank you. All right, Melissa. So this is your 5th visit. So can you give me an update about your headache? You came with the headache.
Yes. So I had it was around June 8th.
Mhm.
I had a headache that lasted for like 3 days.
Mhm.
No matter what I took, it would not go away. And I even went to the urgent care thinking, like, what's wrong with me? Like, why am I not getting better? Normally I wouldn't have a headache that lasted that long. So I came and saw you on a Monday, and immediately you pressed in here, and I just felt this huge release, like, off my head. I think it was tension pulling on my head. And the next day, I felt way better after that. The next day, I was still a little sore and a little fuzzy, and then I saw you Wednesday for the second visit.
Second visit, okay.
And after that, I haven't had any headaches.
So it's basically took 2 treatments?
I would say. Yeah, even the first one was a huge relief.
That's
Huge
good,
relief.
yeah.
Yes.
So today is June 27 or something like that?
28?
Yeah, June 27th.
27. So
Okay.
you've been like headache free for the last
Since
You s-
like that Monday.
it's about 15 days or something like that. Yeah. So and we had total of 5 visits. We're just working on the scar tissue and the strength and stuff like that. So what do you think about ASTR treatment so far?
It's great.
Yeah.
I know 4 years ago I had headaches daily for years, and I saw you. And after like a month and a half, I haven't had headaches since then till now.
Till now.
I don't know what I did, but
So that was like how many years you did not have headache after I treat you like before?
about 4 years.
4 years no headache after. Yeah.
No, I mean, once in a while you get one, but I was getting them every afternoon for like 2 years.
2 years, yeah.
And I just would take Advil every day. I'm like, this is like, I went to other physical therapy and didn't do anything. So I need to get,
to get to the root of the problem.
Yeah, so I was lucky to find you, and then you helped my daughter Carrie with the migraine.
Yeah, awesome. Yeah, I'm glad that you guys doing better.
Yes,
yeah.
Thank you so much.
Yeah, thank you so much. Awesome, thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.